and welcome back. Today, a new focus for regenerative therapy. Doctors are now able to do some incredible things by harvesting a patient's own fat. That means long-lasting results with everything from facelifts and body sculpting to pain management in joints and decreased inflammation in muscles and tendons.
Take it all. Yeah, go ahead.
Yep.
Dr. Deborah Manjoney and Dr. Scott Stanwyck are with the Wisconsin Vein Center and MediSpa with Transformed Therapeutics, and they join us now to explain more about these revolutionary and exciting new treatments. We're so excited to have you both here. Thank you for joining
Glad
us.
to be here.
Yeah.
Let's talk about the aesthetic side first
Sure.
with you, Doctor, and talk a little bit about what you're seeing, because you guys just returned from your second
Right, from the
therapeutic.
That's right. We've been to 2 regenerative therapy meetings this year already, this summer, and the last one we just came back from Monday night. And basically, I would say all the most well-known of the plastic surgeons in Beverly Hills were there.
Really?
Presenting their results.
It's
Was it
gotta be
cool?
exciting to be there.
It is, to a point, and then it's like, okay, enough is enough. But the interesting thing is, even with every facelift, they're doing fat transfer, and they're using what we call micronized fat. So it's fat that's in a smaller particle size than they used to use for fat transfer. I mean, they still need the big elements of fat when they're doing butt lifts and things like that. But when they're doing the face and when they're doing other parts of the body, they're using these smaller particles of fat because they can be vascularized and actually incorporated into your own natural fat and into your own body.
It's interesting because right now facelifts are all the talk in Hollywood. I mean, we saw Kris Jenner, we saw all
Brad
these
Pitt.
Brad Pitt's facelift. I mean, all the women that are getting them, and they're just kind of, and a lot of this is this new sort of regenerative, and that's why everything looks so natural.
That's right, and the skin looks better and better every year, because at the end they put on something that they call nano-fat, which is emulsified fat, and it goes just into the skin, into the dermis, and it can really make a difference. Now, this is somebody we did in our office a few years ago, actually.
So you've been doing
and
this for a while.
We've been doing it, but I've been really selective and not doing a whole lot of them because I wanted to feel that I had the technical skills to do it.
Yeah.
I'm not a plastic surgeon. I don't claim to be a plastic surgeon. I'm never going to do a facelift. But on some people, just the fat transfer, just using this fat will make a huge difference.
Yeah.
Are the results long lasting?
They are. They are, many years.
That's incredible.
And, with techniques coming down the pike, it's going to be even longer lasting. It's amazing.
And why is it better or different than, say, filler? Why is using your own fat better?
Well, I don't want to disparage fillers because we do fillers all the time, but for plastic surgeons in this group who do fat, they say that filler migrates everywhere. It doesn't stay where you want it, and it doesn't
go away
disappear with time.
Okay.
And so before they do any procedures, they dissolve all the filler that's been in your face, or as much as they can get to, by using the dissolving agent, the enzyme that we use. But they just say, it's not true that hyaluronic acid is in a lot of your body. It's in a very small percentage of your body, and therefore don't keep saying that to try to get people to think it's a natural filler. It's not natural. Fat is natural.
Well, and the fat will increase the blood supply, right? And then also integrate with your own body,
Well,
because it is your own body.
It integrates with your body, and it will allow the ingrowth of new vessels, and those fat cells are now going to be able to stay alive. But the key is, once you put fat there, it's stimulating your own fat to grow. So you get your own fat back.
It's amazing. Okay, so let's transition to orthopedics.
Well, what I want to say about the cosmetic part is that these whole regenerative treatment with stem cells started with the cosmetic surgeon people,
that's true.
because they were using fat grafts as a filler, and then they noticed that the quality of the skin improved so significantly that, and it's because of the stem cells that are on the tissue that holds the fat cells.
Yeah.
And those stem cells cause neovascularization, which means more blood supply, which increases the collagen in your skin, it increases the elastin in your skin, basically making you younger. And one of the...
we want that, doctor.
the orthopedic stuff. But I just have to say that one of the cosmetic surgeons at the meeting we went to in Belgium showed a picture of a woman he had done 15 years ago.
Wow.
She looked 15 years younger now than she did before she got
Because
the
naturally
treatment.
it kept getting better.
Incredible.
Yeah, we want to remind everybody they're married.
And you decided to try to outclass me
Obviously, I've
today.
got
I'm,
nothing
I'm Casual Friday. He's up to his game.
You
So
can
now
tell
just-
who has the brains.
Okay.
Well, I got to tell you, doctor, because you know, my friend came to you for stem cells in her shoulder and in her ankle, and she's already seeing incredible results. So you've been using this also then in orthopedics. So you're helping this with joints. I've come to you for my toe that I want to do, but you've really seen your own knee, your patient's knees, shoulders, the joints that are usually degenerating and people are leading to surgery. This is a picture of how it increases, right?
Oh, okay, I have to tell that story. That story was supposed to come towards the end.
It is the end.
It is the end. Okay, good. Well, that image on the left was my elbow after I fell skating.
That's your elbow.
That's my elbow, and that's my triceps tendon that got torn off of my
Yeah.
olecranon, so I couldn't straighten my elbow. The standard for that, now the little dotted line there is
left.
between the tendon and where it attaches to the elbow, and that's a gap. And the standard for that is to put suture anchors in the bone,
Yeah.
sew the tendon, pull it down. But instead, you know, I injected stem cells in the gap, and then a week later, another dose, and that image on the right is complete healing. I could do push-ups at 6 weeks.
Okay, see,
That's
this is what I
amazing.
think is incredible, is it kept you out of surgery, and you're willing to do it on yourself. You know, you've
Oh,
done that with your
absolutely.
children,
Both
your
of my
wife.
knees and my elbow so far.
But the other thing is, you know, Dr. Stanwyck just presented at this meeting, too,
Yeah.
about how red light therapy also can increase the rapidity with which things can heal,
Yeah.
and can actually stimulate your body's own stem cells that are inherent in you, but also stem cells that may be transferred to actually heal things more quickly.
And is the red light therapy something that you do as part of your practice?
Well, what we do is we tell people to buy an inexpensive unit.
'Cause those
and we
work.
tell them which one because it has a lot to do with the strength of the light and the frequency, the wavelength of the light.
And you can buy one that's not going to do anything for you, so you got to buy the right
You
ones.
do. You have to
Yes,
buy the
for
right
sure.
one. You have to use it the right way.
We're out
This
of
is
time.
exciting stuff, you guys.
But you got to come and this is the thing. You guys are doing this, and you're right here in our backyard. So people need to come to you. I've sent my friends. I gotta do it.
It works
Here's the
great.
thing. We all gotta do it.
Thank you both
Thank
so
you so
much
much.
for
Thank
being here.
you.
This is incredible and very exciting. And if you're interested in learning more about the science and the therapies that we talked about here today, contact the Wisconsin Vein Center MediSpot 262-746-9088 or Transform Therapeutics at 262-264-5788. They're located in Pewaukee, and we're going to put all this information on our website as well.